हाय, दिस इज मिस सोनाली। एक खूबसूरत सी बात मैंने आज सुनी है। एक बार नारद मुनि भगवान से पूछते हैं कि आपने इतनी सुकुमार चीज बनाई है प्रभु, इस चीज में ऐसा क्या कर लेगी, क्योंकि इतनी नाजुक है, इतनी सेंसिटिव है, कैसे लड़ पाएगी दुनिया से। भगवान मुस्कुराते हैं और कहते हैं कि मैंने ऐसी चीज बनाई है नारद, जो ऊपर से बहुत ही नाजुक है, बहुत ही सेंसिटिव है, लेकिन अंदर से वो उतनी ही ताकत से भरी है। और वो चीज क्या थी भगवान ने बनाई हुई? वुमेन, स्त्री। ऐसी कुछ कहानी है। लेकिन आज फिलोसॉफी, माइथोलॉजी, इन सारी बातें नहीं कर रहे हैं हम बात कर रहे हैं विज्ञान से जुड़ी, हमारे सेहत से जुड़ी। सो वी आर टॉकिंग ऑल अबाउट आवर हेल्थ। सो डॉक्टर थॉमस चेरियन इज विद अस। एम आई राइट और एम आई राइट? ये हमारे गेस्ट हैं, नागपुर में, हैदराबाद से आए हुए हैं और इंटरनेशनल लीवर ट्रांसप्लांट सर्जन हैं। सो डॉक्टर थॉमस, बहुत बहुत स्वागत है आपका।
थैंक यू।
आपने मुझसे एक स्टोरी शेयर करी जब हम बात कर रहे थे ऑफ द कैमरा, तो उन्होंने मुझे बताया 60% women donate their liver. Is it right?
Well, approximately 60 to 70% of the people who donate livers for the relatives are women.
That's correct.
Whereas 60 to 70% of the people who receive the livers are us men. So we should be grateful.
Indeed. अच्छा, मुझे बताइए, हम बहुत सारी बातें करने वाले हैं और सेहत से जुड़ी बातें करने वाले हैं, और ये शो जो है वो बॉस ब्यूटीज़ है। और लोगों को लग रहा होगा कि बॉस ब्यूटीज़ में व्हाट Thomas is doing here. So not to worry, I just wanted to tell you he's a male feminist according to me, and he do take care of all of us, all our livers. So मुझे बताइए women perspective towards health, क्योंकि जब मैंने ऑफ द माइक एंड ऑफ द कैमरा जब बात करने की कोशिश करी थी, सो उस वक्त पता चलता है कि लाइक लिवर की जो प्रॉब्लम्स होती है, मोस्ट ऑफ द प्रॉब्लम एडिक्शंस की वजह से होती है। इज इट ट्रू?
No, it's not true. So that is a very popular misconception that liver disease is the same or synonymous with alcoholic liver disease. But if you looked at my clinic this morning, 75 or 80% of the clinic was with people who had never consumed alcohol in their lives. I had a 4-month-old baby with liver disease that needs a transplant. So obviously that's not somebody who's consumed alcohol. So this is the first misconception that we must remove, that liver disease is not the same as alcoholic liver disease. It's only a small percentage. Why I feel we must remove that is because of that stigma, that social stigma. Many people are not coming forward with information and facts about their liver disease and quietly suffering until it is too late.
So what are the normal or common reasons of the liver issues or diseases?
So alcohol continues to be a part of it, but I would have thought about the current number would be about 25 to 30% of liver disease is due to alcoholic liver disease. Then there is viral hepatitis. So liver failure or liver disease because of viruses like hepatitis B, hepatitis C, some parvoviruses, some adenoviruses. Then the giant or elephant in the room is fatty liver disease, especially for us Indians, not just the men, also the women, because we are all eating more than ever. We are working less than ever. I meant physical work. And therefore we are ending up obese. And genetically we Indians have a predisposition for developing diabetes. So the combination of sugar and obesity is creating a pandemic of fatty liver disease. I'm sure even in your life and families, if you take an average of people who have gone for an ultrasound scan, at least 50% of people above the age of 40 would have fatty liver disease written on the scan.
Okay. So, is it a reason of the fatty liver disease, obesity? Is it like that, or what are the reasons like?
Two main reasons. One is obesity and the other is sugar.
Okay.
Or diabetes.
So one has to control the sugar and also control the weight.
Yes.
Yeah.
And the secret to both is in the food.
So, let's talk about your life.
Okay.
So you always wanted to be a doctor?
Yeah. From ever since I can remember, I wanted to be a doctor. In fact, I was funny in that even when I was in school, I did not want to be a doctor, but I wanted to be a surgeon.
Okay. More precise. I think your family is a doctor family.
Yes.
So
yes.
yeah, because I know my daughter once she was saying ki, I just asked her come for having a dinner. She was saying ki, wait, I'm just completing press note. So I can understand what the influence of your parent and the family must be there. So one thing, this is the show all about women, and this is the channel is all about also women.
Okay.
So let me know, who is the boss beauty of your life?
I think I am married to her.
Okay.
Her name is Leka. She's a gastroenterologist herself, and I think she's quite pretty. So
Is she bossy also?
no, she's not bossy.
So
In fact, she's not at all bossy. So I often do what I want, and then she says, I told you. And then I said, no, you didn't tell me hard enough.
So you born in Hyderabad, right?
No, I was born in Kerala,
Okay.
but now I live in Hyderabad. I run something called South Asian Liver Institute,
Right.
which is a pure liver-centric hospital that provides liver services to patients in Hyderabad. And we partner with other hospitals and provide transplant services and liver surgical services in Mumbai, Nagpur, Hyderabad, Vijayawada, and now going to start in Calcutta.
You were telling me that you're an international personality or celebrity
I didn't
in
say
this
that.
in the stream of
You
medical
said that.
industry. Yes. No. Yes. Indeed. I told that. So let me know. You had been to UK, right?
Yes.
So is it for your studies or
Yes. So I spent nearly 17 years in London. So I went there immediately following my medicine. I did my basic surgical training there. Then I trained in GI surgery and then in liver surgery. After I finished my training, I worked in King's College London for about 5 years and nearly did about 350 transplants in London. And then I was invited to join a hospital in Hyderabad. And that is how I came back to India. Okay. So my father, whom you were talking about, is a cardiac surgeon who's actually a Padma Bhushan.
Oh.
And he ran a group of institutions in Tamil Nadu. So I run those institutions and I run South Asian Liver Institute.
So when you see the medical industry, how they are working internationally and how they are working in India, what are the differences and what are the things you want you have observed?
Huge differences, especially when you compare UK and India. UK is a very government-centric program where healthcare is free to everybody. So and the systems are so robust in the sense that if somebody has got a skin problem and they live in London or anywhere in England, they would be referred by their general practitioner who's responsible for their health to the dermatologist allocated to that area. That dermatologist would refer the patient to the next higher level at certain checkpoints.
So hierarchy-based things?
Not only hierarchy, it is beautifully based towards specialization. So finally the patient reaches the specialist with the minimum of delays And that is absolutely crucial in treatment of liver disease.
Then why people travel to India for medical things also, for surgeries or medical treatments? Most of them, India is like, I had a couple of conversations with some doctors, and they were saying that government-driven medical industry is there in the internationally. So is it very expensive over there?
Well, not many people are traveling to India from the UK or Europe or the US. Most of the medical tourism to India comes from the Far East, like Bangladesh, Indonesia a little bit, Middle East, and North Africa, where the services are not as good as it is in India. So the services would be good, let's say, in North America, Europe, and Asia. And between these three places, India would be the least expensive, which is why a lot of the medical tourism gets directed to us.
When you see, even if we compare the states for that matter, you are working in Hyderabad right now. Now you are coming to Nagpur. So what about the Maharashtra status?
Yeah, so I think central India, including Vidarbha, is not as well served as South India, for example.
Okay.
So Hyderabad and Chennai have been sort of health hubs for the last 20 to 25 years, and a lot of good services have developed there. For example, I started transplants in Hyderabad way back in 2012, 11, and there were transplants in Hyderabad even before I came. So I did the first ever living donor liver transplant in the new Andhra Pradesh. We did the first liver transplant in the government sector in Hyderabad. We did the first split liver transplant that was successful in Hyderabad. But all that happened nearly 7-8 years ago in Hyderabad, whereas even now Nagpur is just catching up. And that is the whole point of me coming to Nagpur, setting up a state-of-the-art liver transplant program so we can look after children with liver disease. As you said, you're talking about women with liver disease. Today I saw a little girl. I mean, when I say little, she's little in size, but she's 23 years old. And she's got a liver disease that needs surgery. And previously, this service was not available in Nagpur, and she would have had to come to Hyderabad to see me. Whereas now we can sort it out in Nagpur.
So I think what are the common problems you have seen in women for the liver?
Yeah, so the first thing to say is alcoholic liver disease is not isolated to men. At least 10 to 20% of people with liver disease are women, and that ratio is getting worse, unfortunately. But the other typically women-centric liver diseases would be fatty liver, autoimmune liver disease.
Can you please describe what is autoimmune?
Autoimmune. So it's essentially a disease condition where the immune cells that is supposed to protect us from outside toxic agents or infections and other things turn around a little bit and attack some of our own cells. That's why it's called autoimmune. So we are attacking our cells in a little way. But that's a very small percentage of what happens in the body. And sometimes that is directed against the liver cells, which causes autoimmune liver disease. And that is slightly more prevalent in women. And so that's why I mentioned autoimmune. Hepatitis B is also a big disease in women, and like I said, fatty liver as well.
Okay, so I think moral of the story, the lifestyle of a person is very important to keep our liver healthy, is it? Like, if we talk about fatty liver.
You are absolutely right. The funny thing about the liver is, unlike your muscles and other things, you don't have to exercise all day in order to maintain your liver in good health. Just a balanced diet, a fairly appropriate weight for your height. If you are diabetic, you don't have to panic because you just have to get your sugar into control. So in other words, take tablets, take insulin if necessary, but don't allow your sugars to be higher than what it should be.
What is the death ratio about the, like, if the liver damages, and what is the death rate of ratio for it? Is it like
Liver is quite unique in the sense that even if, for example, your brain is not working, there are many people who are on a ventilator in a coma where the brain is not working for months. If your lungs are not working, you can be on the ventilator and the ventilator will breathe for you for months. If your kidney is not working, you know many people who are on dialysis.
One kidney.
One kidney, or even if both the kidneys, they're just on dialysis for 10 years. The liver is so complex that there has never been a liver dialysis machine made that is successful. I was involved in a study in King's College London where we looked at Mars, and that did not work. So even today in 2023, there is not an effective liver dialysis machine, and therefore none of us can survive for more than 48 hours if our livers were to completely stop working.
So this is a very, very important and crucial part of our body, organ of our body. You have to take care. You have to take liver very seriously.
Yes. Especially when you are in the bar.
So as a surgeon, when did you you started taking liver seriously? No, I want to be a liver
surgeon. Yeah. That is a serendipity, because I used to be a GI surgeon in Birmingham rotation, and Birmingham had one of Europe's biggest liver transplant centers. So I just happened to be there, and so I thought, if I'm in a liver center, I might as well take up liver transplant surgery, and that's how that happened.
Okay, so now we discussed multiple things about your professional life. Let's come on the personal ground. So tell me about yourself. How was your childhood?
I had a fantastic childhood. My parents were fabulous. Medical school was fun. I think as far as I can remember, that was the most fun part of my life. And then I went off to England. I spent many years in England, in training in England. So while I was in England, I think I enjoyed some of the fastest cars in the world. I took up photography. So life has been great.
So you're an artist by heart and surgeon by profession.
Yes.
I would just ask you, what is the most rebellious thing you have done in your life? Are you a rebel?
Not usually.
But sometimes.
Sometimes. I think marrying Lekha was very much against my parents, and that is possibly the most
definitely
rebellious.
A love marriage.
Yeah.
So where did you find her?
In a library.
Oh, is it a two-state? What is the story in like 1 minute, if you want to?
So we met in London, and we were both studying for the same Royal College exam. And in London, there was a medical library that many of us used to go to.
Is she Indian only?
She's Indian.
Okay.
Yes.
Yeah.
She's Indian, and that's where we met.
Oh. So whose sarkar is there in power at your home?
I don't think.
I
don't think any of your viewers need an answer. They know the answer.
So you have given me the answer. Still, who is your boss? Who is the boss beauty?
The boss beauty is her, obviously.
Okay. And is it your joint family? Like you stay?
No. We have always lived, because I told you I lived abroad for a long time. So it was just her and me. The rest of my family live here. Her family also lives here.
So your mom, how?
In Tamil Nadu, yes.
Okay. Yes. When she comes, what is the situation at your home? So is it Because normal houses have the normal things.
There is no
uh,
great problems. No.
no, I'm not talking about the problems. I'm talking about how is the problem solving procedures at your place when the two women are there, and how do you, because surgeon you as a fantastic, you must be husband as a fantastic, but as a son you must be supreme. But if two ladies are like having disagreement on one of the topic, does it happen at your place?
Yeah, I'm sure it happens.
So how do you manage? Like how do you, किसको आप पहले समझाते हैं या आपको पता है ये समझ जाएगी, इनको पहले समझा लो?
So I think it depends on the topic, so there are some things that is very close to my mother's heart. So at those times I'll try and push the argument in her direction. And then sometimes I cheat by pushing it in her direction until she's in the house.
So you're a good ambassador. Shanti bani rahe ghar pe.
Yeah, that's right.
Okay, you told that you have a great influence of your father.
Yes.
But it is a show all about women also. Okay. And I just love talking about the male feminists, like they raise with the women, right? So what are the features you feel that you admire your mom the most for those things?
My mom is quite an amazing personality. When she was 28, she was the assistant director of health services for Kerala State. She was just 28, and she's a pediatrician, a children's doctor, and so she went to England when she was maybe 25, and she passed the Royal College exams. What people normally take about 4 years to pass, she I think passed in 1.5 years and was back in England. And then the government invited her because she was the first children's specialist to be qualified from England at that time.
Oh.
And so she became the director of director of health services in Kerala State.
So is there any discussion happens between you and her about, because she's the you told that she was having a great designation and she was working in the benefit of the society. So is there any discussion happens in between you and her about health care of the country?
We constantly talk, especially because I have a special interest in children with liver disease, and so some of the smallest ever child that was transplanted in Hyderabad was done by us. And so when we did it, I remember my mother was very proud. And so we have discussed liver disease in children. But I think her strength was community and primary care for children. And so our discussions were not that much on liver disease.
आपको क्या लगता है as a surgeon क्या बदलाव आना चाहिए? What changes you feel that it should be there for the as a liver surgeon? ये सारी तकनीकी बदलाव आनी चाहिए. All this medical industry should grow like this.
So I think you're absolutely, there's lots to change. The first thing I think that should change is we should become a nation based on fact. Even in 2023, you have an iPhone or a Samsung with touch, but we still believe in a lot of superstition, especially when it comes to health. We think that I remember maybe 2-3 years ago, I saw a very fat child in clinic, and I asked his mother, what's going on? Why is he like that? No, doctor, he's very healthy. So for a minute, I didn't know what she was talking about until I figured out that she meant that healthy is equal to being fat.
Okay.
So my point is, a child should generally be thin. That is the natural thing of a child, because they're supposed to be running around, they're supposed to be climbing things. And a thin child is much easier for her or him to stay thin as they grow old. And that's just one example. Jaundice is another example. Even today, people with liver cancers are sitting at home on medications given by some local doctors, waiting for the jaundice to disappear while their cancer is growing inside. So we must become a nation based on fact and get investigated if there is a serious symptom that people are suffering. Second thing is that people, and I think that is a message to us doctors, is that we must try and find solutions for patients, in the sense that it's very easy to say that, oh, he's 68 years old, he's had his life. But if there is a good treatment option for him or her, why should we not take it? So I think we must not give up so easily on healthcare, because medicine has advanced a lot. There are patients whom I have who in Mumbai, a city like Mumbai, were told, oh, this is an inoperable cholangiocarcinoma, and then 3 months later we were able to take it out, and now 5 years later he is alive and well. So I think the third thing is be aware that there is a lot of progress in healthcare, and we must, utilize that.
So surgeries are cost effective in India? Is it?
Cost effective in the sense that what is the price of life? So without surgery, if you're going to die, what is cost effective?
Like India, GDP of India and everything, and the normal pocket size of the normal common Indians are like, and the medical fees are like huge. If a person...
You're right. You're absolutely right. So surgery can be cost effective even if you look at it in terms of pure financial sense. So there's a child who I think was about 22 months old. That child had PFIC, which is a metabolic liver disease. And by the time the child was 22 months old, the child had been in 3 ICUs, having had 3 ICU admissions, multiple hospital admissions, and that father had spent approximately about 17 lakhs within that 22-month period. So now, a liver transplant costs sometimes 18 lakhs, sometimes 20 lakhs. So if you don't know this history, you would have thought that 20 lakhs is a lot of money. I'm not saying 20 lakhs is not a lot of money, but what I'm trying to say is that poor father would have spent that 17 lakhs and the child would have died in another 2 or 3 months. So isn't it far better to spend that same amount of money and have a well and happy child? And that's just one example. If you look at adults, it is just the same. Somebody with alcoholic liver disease who's got cirrhosis would have spent 10 to 15 lakhs in ICUs and hospital treatments and endoscopies and tapping, while slowly getting worse and worse, whereas a single operation would have turned his life around and he'd have got back to being normal. So when you look at that quality of life, survival itself, I think surgery is far more cost effective than any other option for certain diseases.
Okay. So you shared beautiful information around liver, because हमने liver को कभी इतना seriously लिया नहीं था, honestly, and this is the first time.
So after this,
yeah, definitely. बाकी सारे organs में कैसे बड़ी-बड़ी बीमारियाँ होती है, तो हम थोड़ा सा उनको ज़्यादा इज्जत दे देते हैं. We give lot of respect to the other organs like brain. We have seen multiple.
But can I ask you? My Hindi is not so good.
Please, like my English.
But jigar means what?
Yeah.
Correct?
Yeah.
Jigar means liver.
Liver.
So when people say you're
मेरे जिगर का टुकड़ा तो लीवर का टुकड़ा, तो मुझे लगता है सारे जो बॉलीवुड के लिरिसिस्ट है उन्होंने कुछ गड़बड़ तो नहीं लिखा, पर अभी मुझे लगता है कि नहीं, लीवर इज अ वेरी वेरी इंटीग्रल पार्ट ऑफ,
एग्जैक्टली,
एंड वेरी क्रूशियल. इसकी भी मतलब उतनी ही केयर करना चाहिए जितने कि आप अदर ऑर्गन्स के बारे में सोचते हैं, सो अच्छा रहा ये जिगरी कॉन्वर्सेशन, आई मस्ट से।
Thank you.
और हमने ये कोशिश करी थी, बॉस ब्यूटीज इज डेफिनेटली ऑल अबाउट द वुमेनहुड, एंड इफ वी टॉक अबाउट वुमेन्स हेल्थ, आपसे बेहतरीन इंसान कोई हो नहीं सकता था जिसके जो हमें लिवर के बारे में इतनी अच्छी से इंफॉर्मेशन दे। और एक बहुत अच्छी चीज़, क्योंकि डॉक्टर्स का इंटरव्यू लेना इज लॉट ऑफ गोइंग थ्रू द लॉट ऑफ मेडिकल टर्मिनोलॉजी, जिसकी डिक्शनरी हमारी बहुत ही खराब होती है। आई थिंक योर निकनेम इज टॉम, राइट?
Yes.
या सो टॉम, थैंक यू।
Pleasure.
सो दिस वाज थॉमस, एंड मैंने जैसे कि कहा था कि जितनी खूबसूरत चीज़ भगवान ने बनाई है, दैट्स अ वुमेन। उनके अंदर जितनी ताकत है ना, वो ताकत को इस्तेमाल करो, लेकिन साथ ही साथ ख्याल रखो अपनी बॉडी का। दैट्स वेरी इंपॉर्टेंट यार। कभी कभी हम दूसरे के सबका ख्याल रखते रखते ना अपना ख्याल रखना भूल जाते हैं, और वो ज़रूरी है। टेक केयर ऑफ़ योर हेल्थ। थैंक यू सो वेरी मच फॉर वॉचिंग अस।